Just-in-time training, or JITT for short, helps you rapidly learn and use evidence-based treatment methods. Each treatment available in Willow has its own information page in the JITT library. You can go to the JITT library here in the top navigation, and when you select a specific therapy, then you can learn more about what that therapy is, why you would do it, when you would do it. You see a big picture map of how you move through the phases or stages of that treatment, from how you get started at the very beginning with a new patient, all the way through to the end of therapy and relapse prevention. And then all of the materials you need to do the therapy, the worksheets, assessment measures, and so on, are all organized so you can easily find everything. When you think a treatment is appropriate for a patient, then you can add it to that patient's treatment plan. So when you add a treatment or a protocol, it looks like this on the bottom of the treatment plan page. You'll see that Willow has organized all of the evidence-based protocols and therapies into therapy tasks. These are all the steps you do as the clinician to deliver the intervention. And then it groups those therapy tasks into suggested session-by-session agendas called expert playlists. So we've built Willow in a way that you can choose either to do a whole therapy, sort of by the book, start to finish, just as an expert might recommend, or you can build a treatment plan from scratch. Just select those specific therapy tasks that best tailor the treatment for your patient. You can also tailor the expert playlist where you just click and drag and reorder it to make it better fit your particular patient. Now you can quickly preview any therapy task to see what they are. You just roll over the task, you get a little thumbnail of what's involved with the task. You'll see each therapy task has a ballpark estimate of how long it might take. Most tasks have some videos or a worksheet or other tools, and you should just feel free to explore. Now, once you've selected or ordered your agendas as you want, those agendas show up on that patient's dashboard. So you'll see here the first session tasks of the protocol I added to this patient's treatment plan are appearing here on my agenda. And all of these therapy tasks have a similar format. The name of the therapy task, the estimated time you might allocate to do the task, which of course is going to vary based on your particular client. And then when you click on the therapy task, you'll see the details of it appear in your work area. Often the very first thing in a therapy task is going to be a video of an expert talking about that task. And they talk as if they were in the room with you and your patient. And it's a way of supporting you and your patient in your work together. Then if a therapy task is new to you and you're learning it for the first time, probably the easiest thing to do is just preview that therapy task before the session and watch the videos. So some of the videos you may like well enough that you actually want to play them with your patient. Others you'll just use as a model of how to do the therapy task so that you can train yourself and before you have to do it yourself. Then you'll see here also there are important subpoints are called out for you. These are the points so that you have a glanceable reminder of what's involved with the therapy task. And as you become more experienced, you'll probably have the tasks memorized, and so it'll just be a helpful reminder or cue. But when it's newer to you, you can expand this to see more detail. And then the other thing is down here below are discussion guides. These offer you ideas for assessment questions, alert you to the kind of typical problems you might encounter as you do the therapy task, solutions you might consider, and so on. Now, the last thing that's super cool is that when you add a therapy protocol to your patient's treatment plan, Willow automatically copies your agenda items to your session note. So documenting your session starts to be very quick and very easy.